Good afternoon, everyone. On behalf of the Hepatitis B Foundation and our partners at the Association of Asian Pacific Community Health Organizations, APCHO, I wanted to thank you for joining today's webinar. My name is Catherine Freeland, and I'm the Public Health Program Manager at the Hepatitis B Foundation. We're excited to present today's session on Hep B United mini grants, expanding reach one grant at a time. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and will be muted during the presentations. There's also a phone-in option, and call-in numbers are listed here. You may submit questions in writing during the presentation by typing them into the question box. We will be reviewing questions as they come in and hold a question and answer period after the presentation. And finally, today's webinar is being recorded. You will receive an email with a link to view a recording of today's presentation after the webinar. Just to review what we're talking about today, the mini grant request for funding for the Hepatitis B Foundation and Hep B United was just released last week. We are offering mini grants for 1 year to Hep B United Coalition partners working on hepatitis B education, screening, and linkage to care activities. Up to 8 awards will be given, ranging from $5,000 to $10,000 each. Applicants should be able to demonstrate that they have in place an active local coalition focusing on hepatitis B education, screening, and linkage to care activities. Eligible applicants must be current Hep B United members with the capacity to directly implement the proposal, collect data as required, provide written reports, and manage the funds appropriately. Applicants must submit a project narrative and work plan and will be evaluated by a grants committee. The purpose of the RFP is 1, to educate providers and communities to reduce health disparities, 2, improving testing and linkage to care to prevent HPV-related liver disease and cancer, eliminating perinatal transmission, and strengthening surveillance to detect viral hepatitis transmission and disease. The deadline information can be found online at hepbunited.org, and this link can provide you with the application. The deadline is 5 p.m. on August 1st, and they can be emailed to the email listed here. Now I would like to introduce our presenters for today. These are excellent women who represent the best of the mini grants program and what can be accomplished through the mini grants program. First speaking will be Kathy Fan from the Health Initiatives Project Manager from Hope Clinic in Houston, Texas, followed by Dr. Hong Liu, who's the Executive Director at the Midwest Asian Health Association in Chicago, Illinois, and then Dan Tam Than Hong from HBI Minnesota, the program manager there in the Twin Cities will conclude our presentations today. And you will have an opportunity at the end to ask them questions. So with that, I would like to turn it over to Kathy to start her presentation.
Hi everybody, my name is Kathy Fan. I'm with the Asian American Health Coalition Hope Clinic in Houston, Texas, and I'm the Health Initiatives Project Manager there. This past year we were actually a recipient of the Hepatitis B Foundation mini grant to create Hepatitis B Registry.
Next slide, please. So just a little bit of background about who Hope Clinic is. We were established in 2002 by the Asian American Health Coalition as a 4-hour, once-a-month volunteer-run clinic. We moved out of that, we were housed in the Chinese Community Center, and then we moved out in 2007 and became a federally qualified health center in 2012. Currently, we actually have 3 sites, and we do everything from family practice, OBGYN, and pediatrics, and we have over 47,000 patient visits a year. With our FQHC status, we do accept everyone with and without health insurance, and regardless of the immigration status. Next slide, please. So what makes us a little bit unique is that we speak over 28 different languages, and we serve over 70 different ethnicities throughout the year. Our staff, we staff them from the community, so we invest a lot in our communities to build them up, and then we hire them on so that we have that relationship already with the community. Some of the popular languages that we have inside the clinic is, of course, English and Spanish, Mandarin, Cantonese, Vietnamese, Burmese, and Arabic. Currently, we are still growing the number of languages that we can speak in-house to include other languages such as Rohingya. Next slide, please. And so going over some of the services that we have, again, we have primary care services. One of our sites, we specialize more in women's health, where we have hospital privileges and we can deliver there as well. We do a lot of pediatric care as well as immunizations. We also have a registered dietitian who can do nutrition consultation. We have a whole team of case managers, and we also have a behavioral health department. Next slide. We also have eye clinic and dental services, which we put on the same sliding fee scale as our primary care. So we can do discounted frames, we have contacts, we can do vouchers, and we try to help our community be able to afford the glasses and contacts that they need, especially for students in the community. With our dental services, we have certain price ranges for fillings, sealants, but for those who don't have health insurance or dental insurance, we put them on a sliding scale fee as well. Next slide. So some of our programs that we do outside of just hepatitis, we also have our Phoenix Project, which focuses on breast cancer awareness, education, screening, and treatment. We're able to secure some funding to help women be able to get their mammogram screenings. We are able to send staff out to educate about breast cancer and the importance of mammogram screenings. We also noticed that there was a high number of cervical cancer in our community, especially in the Vietnamese women. So we started an initiative where we would allow reduced price pap smear, and we created an event called Papalooza. So uninsured women and those who haven't had a pap smear in over 3 years were able to qualify for this event and be able to get a pap smear, a clinical breast exam, and then if they qualify, a free mammogram. One of our newer initiatives is our nail initiative teaching, interactive teaching, I'm sorry. Because Houston is a very diverse community serving a lot of immigrants, many immigrants come over and work in nail salons, but the conditions that they work in may not be the best, and many of them don't have health insurance, nor are they aware of certain health topics. So we started a nail IT project to go out to target these specific nail salon workers and educate about different types of cancers, breast, cervical cancer, hepatitis B as well, and then talk about social determinants of health to get their feedback on what is safe for them, what chemicals are they working with, and even worker rights. And our newest initiative right now is actually our CRC. It's our colorectal cancer initiative. Because we are so low in our screening, we started implementing this program to increase our screening rates amongst our patients. We're realizing that many patients have a lot of cultural and language barriers that needed to be overcome. So we assigned someone to go into the exam rooms and educate them and help assist the providers to spend more time in educating and being able to order the exams. Next slide. However, so this is a few examples of whenever we go into the community. Next slide. But one of our more successful projects that we love to talk about is our Be Free Houston. That's our hepatitis B initiative. When we first started, we had a very high rate of chronic hepatitis B patients, but many were not aware of their status, and so we started screening the community. We would actually provide vouchers for them to come in and screen, but now we've actually moved to more of a best practice of anybody who walks in with a pulse gets to be screened for hepatitis B and C. So we have a nearly 100% rate of screening. We've also been able to vaccinate and educate a lot of our community members. So we started doing that multiple years ago, and then we realized that another component to that was missing was a linkage to care. We were able to help some of the patients in our clinic, but the problem of linkage to care was much bigger than ourselves. So with the mini grant, we proposed to create a hepatitis B registry. That way we can keep track of patients and make sure that they're coming in for the appropriate follow-ups, that they're getting their medication on time, and if they do decide to switch to different providers, that they would be aware of their status and they would know who to contact in order to transfer the information. So we started to create a registry in our electronic medical record. Within that registry, there was a questionnaire that asked questions such as, do you know what hepatitis B is? Do you know what your current status is? Are you currently taking your medication? How often do you miss your medication? And when was the last time you've seen your doctor? So we create a questionnaire and we can fill it out, and it comes into something called a flow sheet. That way, anytime the patient comes back, the doctor can take a look, and it can be a part of some sort of a sheet that you can see for every visit whether or not the status of the patient has changed. What we found out is that through our calls, we noticed that some patients knew their status, but they didn't know what that meant. So there was a big lack of education. So we started to increase the education. We also found out that many patients didn't know that they need to come back to get a follow-up, or that they need to refill their medication and take their medication once a day. So with that, we were finding a way to keep track of the patients and bridge that relationship between the provider and the patient was very helpful. That has really helped increase the number of show rates of our patients, letting them know how important and imperative it is that they come back for their visit and follow up with the doctor so that we can monitor their count. And then, so again, we wanted to not only educate our patients, but we wanted to build the capacity in our staff as well as providers throughout the city. So we hosted trainings and education about hepatitis B and C in our Asian Cancer Council meeting, and then we actually had the National Viral Hepatitis Task Force come to Houston, and we were a host site for them to train a lot of our staff as well as other providers working with hepatitis patients in the community. One of the things that we realized is that many family or primary care providers didn't realize that they had the capacity to help treat either help manage hepatitis B patients or even treat hepatitis C patients. So we wanted to be able to take the time to share our best practices and how we can manage it in-house and how they can replicate that program. So through the different trainings, we were able to raise awareness within the providers as well. But overall, one of the biggest things that really helped to make this registry happen was identifying key stakeholders that can lend support, whether it's manpower, whether it's technical assistance, or just raising awareness. So one of the partners that we were able to get support from was the City of Houston Health Department. They were one of the first groups that we approached, and they were actually, it was a very opportune time because they're actually in the middle of creating a state of health website where it was a portal that would collect all different types of data and be able to put that in there. So our hepatitis B registry went hand in hand with that, and they were very supportive. We actually able to come out and talk to their epidemiologists as well and share with other staff members about hepatitis. Next slide. So this is just a couple of pictures of the trainings that we had. The top two pictures were from the training with the National Hepatitis Task Force, and then on the bottom right-hand corner, that was when we talked to the City of Houston to kind of share what we were doing and what part they can play in building up this hepatitis B registry and really raising awareness in our community. Next slide. So with the registry, we haven't been able to get full updated numbers for 2016, but for 2015, we were able to screen over 1,000 new patients. And we know that for a fact that as our clinic grows, those numbers will continue to grow. We were able to diagnose 49 new cases of chronic hepatitis B, and that means that these patients were not aware of their status before. And in 1 year, we are able to provide over 6,000 immunizations. So that pretty much, that's a lot of people to keep track of, but it takes a lot of different individuals to make a program work. Next slide. So this is a little bit of what the registry looks like, and I'll show on the next slide. One of the challenges we had was getting it integrated with our electronic medical record. We are using something called eClinicalWorks, and during that time there was a new update coming out. There was not a lot of capabilities to create your own structured data, so we had to actually hire a data consultant to help us build this registry into our EMR. So that was some of the funding that we used from Hep B to put into building this component. That way when we put in data, we can pull it out. So in the meantime, we didn't want to fall behind on capturing patients, so we actually started using a Google form when we would call the patients to follow up with them and then answer through that. So we had a encryptor where we could identify, only person with the password could identify the patients, and then we would just enter the information onto the hepatitis B form. So on the top right, you'll see the different questions that, the top left, you'll see the different questions on the Google form that we had. Once we were able to incorporate it into the EMR, you'll see that on the top right, that's our flow sheet. Whenever they come in for a visit, we want it to be sustainable. So we started off having staff members and volunteers call the patients who already had chronic hepatitis B, and were aware of their status, or at least marked to have chronic hepatitis B here at the clinic, and had a past appointment with us. So we called those first, and then we worked with the providers to, from this day forward, that they would start entering it in. And so on the bottom, you'll see the patient tracking. So as the medical assistants or the nurses or providers would go through these social questions, if they had chronic Hep B, these questions would pop up, and the providers would be able to answer that question, and it will automatically populate the flow sheet for us. So you can see, hopefully throughout the years, you can see their status, and we're hoping to see just better linkage to care. Next slide. And so just going over some of the challenges, I had mentioned that it took a little bit of a while to get started and incorporate into the EMR. Thankfully, we were able to get a consultant and got the upgrade that was able to accommodate for it. It also was a challenge to find the manpower to call in all these patients and ask questions, because many of our patients did not speak English or had limited English proficient. So we had to either find staff members or use a translator line to communicate with the patients, which also leads into language barriers. However, even though we had those challenges, some of the successes we've had is we've had a lot better data collection, which we can actually use to leverage more funding from other resources. So that's been very helpful. We've been able to help schedule patients in an appropriate time. So when we call them, we can see that they don't have a follow-up yet. We can go ahead and schedule them for that right then and there. We're also able to increase their awareness in the community, and then have them be able to be a champion in the community and talk about hepatitis B. And through this, we've been able to make some really great collaborations and have partners that can help support us in this registry as well. We are able to share this information with the City of Houston, and hopefully be able to find other partners who are willing to contribute to this as well. Next slide. So that's pretty much it about our mini grant. If you have any questions, please feel free to contact me. My information is on there. Thank you.
Thank you so much, Kathy. That was great. We'll go on to our next presentation. Dr. Liu, would you like to start?
Yes, hi. Good afternoon. Thank you for the opportunity to present our Hepatitis B program supported by Hepatitis B United mini grant. Next one, please. And so the Hepatitis B Education and Prevention Program is one of the key programs with the Midwest Asian Health Association. We provide very comprehensive hepatitis B program intervention, which includes community hepatitis B awareness and education, screening, immunization, follow-up care and medication, as well as patient referral and linkages to care. We do not just stop with one services. We provide the services from the right beginning to the end. We start with education and recruit patients, clients to come for our hepatitis B screening for surface antigen and surface antibody to identify if the client has immunity for hepatitis B, or if the client is a HBV carrier, or if the client is susceptible to hepatitis B. Next one, please. And if the clients have no immunity, then we provide hepatitis B immunization to provide 3 shots within 6 months in our clinic. Next one, please. And then for those identified hepatitis B carriers, we will schedule individual appointment with our doctor hepatologist, Dr. Sean Coffey from UIC Liver Center, and he comes here once a month to provide follow-up care to our hepatitis B patients on an individual basis. These 2 girls are interpreters from Northwestern University. They help with the interpretation. We also provide, in order to identify the patients who need treatment, we provide further tests, including liver function, DNA, AFP, or other tests to determine. So Dr. Coffey used this data, the lab results, to determine if the patients need treatment or medication. And then if the patients don't have insurance or cannot afford medication, we will apply for patient assistance program from a Gilead pharmaceutical company to help them get medication. And then if the patients are serious, they need further diagnose tests or treatment, we will link them with the UIC hospital, Liver Center, or Cook County Hospital for further treatment. Next one, please. And then lesson number 1, because the population we target are most difficult, most hard-to-reach populations, we have to develop different strategies, marketing tools to outreach to them. So we have a Facebook, Twitter, Chinese WeChat, and a website, and then other community events to distribute information. Next one. The most effective marketing tool is the Chinese WeChat public account. It's a Chinese social media tool in the cell phone. It's in Chinese. Maha, we create a public account and ask people to scan our WeChat bar on the right side, and then once they activate this account, all our news, events, articles will go automatically to their cell phone. They can review our information through their cell phone, and they can also forward our information to their friends, to their social network. This is the article we published in our WeChat account regarding the May Asian Heritage Month National Hepatitis Awareness Day event on May 6th in Chinatown area. Next one, please. And we asked our clients, well, they heard about MAHA. So the most effective marketing tool is the social network and the WeChat. About 64% of people say they heard about MAHA's program through WeChat and the social network. We realized that now the local newspapers, posters, flyers are less effective than before, because now people are using cell phone to get a lot of information. They do not bother to pick up newspapers or keep their flyers. So it's less effective now with the Chinese WeChat coalition. Next one, please. Lesson number 2, of course, because of the challenges faced by our targeting populations, we have to find ways to reduce barriers to access to our services. Which include convenient location. Of course, we are located in the Chinatown area within walking distances to our participants. So they don't have to drive and look for parking place. So they can just walk to our clinic. Of course, we provide language assistance. All our staff, navigators, volunteers are bilingual. The most important factor to attract participants is the convenient schedule. A lot of our clients, they are new immigrants. They work in the Chinatown areas, in the restaurants or grocery stores. They have to go to work early in the morning, not early, at 10 o'clock. So all our events, we have to schedule early in the morning, starting at 7:30. Then they come earlier, line up outside of the office to get registered. So by 10 o'clock, most of our events are finished. Then the clients can go to work to catch their morning schedule at 10 o'clock working in the restaurants and the grocery stores. Which those services including screening, immunization, and follow-up care. We start early in the morning, 7:30, 8 o'clock. Next one, please. Lesson number 3 is we try to integrate the hepatitis B services with other services so to attract a large number of participants. We not only just provide hepatitis B services, we combine those services with other assistance, including insurance enrollment, post-enrollment services. For the hepatitis B patients, they have concern about looking for providers and then what medication is covered by their Medicaid or other insurance, what are the packages that are most suitable for their seeking special care. So we provide a lot of guidance and navigations for those patients who come to us for Hep B and other services. We realize that if we advertise just to say come for hepatitis B screening, education, or immunization, we have low participation. So we advertise as to provide the primary care, annual checkup, the screening not just for Hep B, but including a comprehensive chemistry, cholesterol, hypertension, diabetes. Then we have a large number of participants come. During those events, then we will incorporate hepatitis B screening into those services, and we ask people, have they ever tested for hepatitis B? If they say no, then we will add hepatitis B screening to the comprehensive chemistry. Which the follow-up care, we also, not just for Hep B, we will have physicians, medical students come here to provide diabetes screening, education, hypertension, and cholesterol. So we combine the services for Hep B as well as other primary care components to get more participants. Next one. Lesson number 4, of course, we cannot do all those without the coalition working together, without the stakeholders and the partners. We have 4 universities in Chicago to actively involved in our hepatitis B program, which include Northwestern University, Rush University, University of Illinois at Chicago, and Midwestern University. So they are the important resources of physicians and students, medical students, to help us sustain this program. We have very little funding for this program, but we can sustain because of those volunteer services, the partners. And we are also supported by Illinois Department of Public Health and the Chicago Department of Public Health for providing vaccine, providing small funding for this program. Next one. So from 2015 to 2016, we screened about over 1,000 people. 13% is identified as a hepatitis B carrier. This is most of the Chinese population. 26% of people who are susceptible, we follow up with immunization. And then 51% have immunity, so we don't need to do anything for them. Next one, please. So I'm going to present some data and the finding for our hepatitis B carrier, some of their demographics information. Next one, please. So among those hepatitis B carriers identified through our screening, 54% of people say reported they do not know they are hepatitis B carrier. So which is very important for our community services. If we don't provide the screening, those 54 people will have no idea about they are already the hepatitis B carrier. Next one. The same situation, we asked those hepatitis B positive patients, have they ever been tested for hepatitis B? And about 50% say yes, about another 50% say no, they have never tested for hepatitis B. So they have no knowledge regarding their status. This is also an indicator of how important our services are. For among those hepatitis B carriers, the age distribution we can see is most of the people come to our services who are identified as hepatitis B carriers among the age of 26 to 65. One of the reasons we have less senior people is because they have Medicare. They go to their Medicare providers. Next one. And by gender, about 55% of people who are hepatitis B carriers among our groups are male and 45% are female. Next one. Among those hepatitis B carriers, 30% reported they have a family history. The other 69% say no, but no doesn't mean they don't have a family history. Some of them just simply do not know whether they have a family history. Next one. Most of our patients, they have lived in the U.S. less than 15 years. So a lot of new immigrants so the majority from living in the U.S. from 5 to 15 years. 15 years. Next one. An insurance status, for some reason, even if we have a pharmacare, the enrollment program, still among those hepatitis B carriers, there is a large number of people who have no insurance. A lot of them are undocumented. They are not eligible for Medicaid. They have low income. They cannot afford for private insurance, or they have documentation issues. The majority of the people are medically underserved and no insurance. Next one. Educational level, for among those hepatitis B carriers, most of them, majority, 50%, over 50% with less than high school degree, and 38% with high school education. So the characteristics of our population is low education, no insurance, most new immigrants. These are the demographic characters of our population. Next one, please. Because of we have more data, but for the time, due to the limit of time, these are all key findings from my program. I thank you very much for the Hepatitis B United for providing the mini grant to support our program. Thank you so much for your attention. If you have any questions, you can get in touch with me, Midwest Asian Health Association. My name is Hong Liu. Thank you.
Great. Thank you, Dr. Liu. That was wonderful. All right. And with that, I will turn it over to Dan Tam for our final presentation.
Hi everyone, my name is Dan Tam Phan Huang and I am the Program Manager for HBI Minnesota. Next slide please. So a little bit about us is we're a nonprofit that started back in October 2015 to provide free hepatitis B and C testing education linkage to care for underserved communities. For those who have not been vaccinated, we refer them to a program called Uninsured and Underinsured Adult Vaccines by the Minnesota Department of Health that provides free hepatitis B vaccines. Our approach is a very grassroots based. So what we do is we work with different community leaders to ensure that the materials we make for the program are linguistically and culturally appropriate. And we also bring the services to the people, because the people we try to reach don't always have access to transportation and other barriers. So we can be at offices, markets, places of worship, schools, and more recently, festivals. If you've heard of Hepatitis B Initiative of Washington, D.C., this is the Minnesota chapter version of that program. Next slide, please. So our focus was on the Hmong community because in Minnesota it's the largest Asian community. There's also a 16.8% Hep B prevalence rate by a study back in 1997. They have a high prevalence rate because not a lot of people talk about it. There's a huge stigma associated with it. And a lot of the Hmong people are from Southeast Asia, where hepatitis B is endemic, such as Laos, Thailand, Vietnam, and also China. These people frequently travel back to the homeland to visit family, and they also have large family members in a household. It's very common to find people with more than 4 members in a household, and they share different hygienic tools, such as nail clippers, toothbrushes, razors. There's also a cultural norm, and a lot of people believe in shamanism, so it means that if we take their blood, then it's not replenishable. So they don't have their complete soul for the afterlife. So that's been another challenge on why a lot of people have not been tested before. Next slide, please. So this is just a CDC map showing Hep B prevalence, and as you can see in Southeast Asia, on the far right is where most of the Hmong people are from. Next slide, please. So of course we would not be able to reach anyone if we didn't have our testing partners. Our main one has been the Hmong Healthcare Professionals Coalition, and they've been around for 20 plus years now doing free health fairs for the community. The coalition is a bunch of medical and public health providers who volunteer their time to put on these yearly events. Next slide, please. And for those who do test positive in our events, we link them to care if they do not have their own primary care provider. So we have a multidisciplinary team located in Twin Cities, which is St. Paul and Minneapolis area, of infectious disease, transplant surgeons, primary care, and also hospitalists as well, and pharmacists. Next slide, please. So these are just some of how our providers volunteer their time. Most of our events are on the weekends just so that the community are able to attend. So in the upper left-hand corner is one of our Vietnamese hospitalists. He is at, I believe that was St. Columba, and it's a Vietnamese church on a Sunday to provide education in Vietnamese for the elderly. On the bottom left-hand corner, we have 4 different people. We have the Minnesota Department of Health Perinatal Hep B Coordinator, Dr. Mua Lo, who is our Hmong primary care provider. Next to him is an infectious disease provider, Dr. Frank Rame, and then far right would be Dr. Omar Magoob, who is a Sudanese transplant surgeon. And then on the far right is Dr. Robin Councilman, who works at a federally qualified health center, and she sees a lot of Hmong patients who have liver cancer, so she's been especially passionate in helping us get the word out there. Next slide, please. So, since we reach a variety of different communities, we try to make sure that we have the correct resources so that they understand. As you can see, this flyer, it says that it talks about hepatitis B, about getting vaccinated and how the vaccination helps prevent liver cancer. It's all in Hmong. On the upper left-hand corner, we are actually at a Sikh temple. So with their beliefs, we're supposed to cover our heads and remove our shoes. So we did that by bringing headscarves, in addition to providing liver models, because we find that a lot of the people we reach out to don't always speak the language, or they cannot read or write. So at least having a liver model that they can actually feel really helps illustrate the issue. And then bottom left is posters as well to show where the liver is, what it looks like, and this is what can happen to the liver. Next slide, please. So along with reaching different communities, media has important, particularly in the Hmong community, because like I mentioned before, not a lot of people read or write, but Hmong radio and TV is a great way to reach out to the elderly population. So the upper left-hand corner, we were able to do a talk show with a local TV station called Hmong TV, where we posted it on YouTube, and as you can see, it's getting quite a bit of views. I wasn't able to speak much because the program was completely in Hmong, but my translator is to the left, and then to the right is Dr. Mualo. Also did an article for Hmong Times, which is a Hmong newspaper, except that you could write English and Hmong in it. Bottom left, or the bottom screen, would be Hmong TV Network, another local TV station that has broadcasted a lot of our events in addition to providing advertisements, and they are working with us on a PSA as well. Next slide, please. So another way is Hmong FM Radio. That is a local radio station located in Minneapolis, and they have two stations. They have one for St. Paul and Minneapolis to cover the whole Twin Cities. On the top right-hand corner was last year when we were first promoting our program because we were so new. We had Dr. Lowe on there educating the community about hepatitis B. At the bottom right-hand corner was this past May for National Hepatitis Testing Day, so more people were aware of our program. So we were just promoting national hepatitis testing and talking about our upcoming events. And I also put a link if you were interested in listening to the program. It is in English. Next slide, please. So thanks to the Hepatitis B Foundation Story Center, we were able to recruit some storytellers from Minnesota to go train and create YouTube videos to tell their story. So two of the storytellers that we were able to recruit were willing to share their stories about their dad, who actually has had hepatitis B and C that caused liver cancer. So he passed last October, and if you're interested in hearing more about their story, I linked the YouTube video right there. Next slide, please. And Gok, who is one of the daughters, we had an event at an international market in April where she created a poem and read it out to the audience. It was very touching, and I also linked the YouTube video at the bottom. Next slide, please. So, of course, along with educating the community, in order to change policy, we also need to educate the legislators. So one of the legislators I have met with in the past is Councilman Dai Tao, and he has been to quite a few of our events, and he's very aware of our efforts. So he took a picture with us and visited us at Lo Mi Kang Night Market this past weekend. And then on the right is actually Miss Hmong America, and she was very willing to have her picture taken as well. And we're trying to organize an event for September to raise even more awareness and testing in the Hmong community. Next slide, please. And along those lines, in addition to educating the local community, we try to reach as many people as possible. And we know social media has a broad reach, such as international as well. So as you can see, just from, I missed this year's Hep Chat because we had an event, but last year's Hep Chat, we were able to increase our profile visits, some mentions and tweet impressions, in addition to having a Facebook page where it's very interactive just because we could post videos and pictures on there. And we also have a website that links to all of our social media. Next slide, please. So our efforts were noticed by the World Hepatitis Alliance for May for Hepatitis Awareness Month. So they featured one of our events this was an event with a Hmong provider, and he educated over 150 Vietnamese elders with the help of the program manager for the Vietnamese elder program, who also interpreted for him. And then on the right, they featured our May events where we worked with the Hmong Cultural Center to help screen their ESL and basic education students, in addition to having the radio show. Next slide, please. So this is our 2016 report. Although we started back in October 2015 with outreach, we didn't have our first testing event until February 2016 because it takes a few months to gain the community's trust. And in 2016, we tested 634 for Hep C, found a 1% positivity rate, 312 for Hep B with a 5% positivity rate, 41% needed vaccinations, 39% cholesterol, and 22% glucose. So similar to MAHA, instead of just having hepatitis testing events where there's a huge stigma associated with it, we just call them health screenings and do a full blood draw for all 5 tests, testing to see if they have hepatitis C, if they're infected with hepatitis B, if they've been vaccinated before, their sugar, and then their cholesterol levels as well. And these are some of the residents we've served. So St. Paul, Minneapolis, and the surrounding suburbs. Next slide, please. So if you have any questions, feel free to reach out to me. I have included my email, phone number, and then you can always reach me on social media as well. Thank you to the Hepatitis B United for giving us the opportunity to share our work.
Great. Thank you so much, Santam. All right, so now we will begin the question and answer portion of our webinar. As mentioned at the beginning of the call, we will start by answering questions submitted via the chat box. If you would like to submit a question now, please do so by using the questions field on your screen. So with that, our first question is, and I believe this is for Kathy. What educational resources and materials are you using to educate patients?
Okay, so that's a good question. We actually use a lot that comes from Hep B United Foundation and some from Gilead. We are able to get some of their models and use that in the community. Gilead also has a lot of different languages, such as Vietnamese, Chinese, Aramaic, that they were able to provide for us actually at no cost. And that's been really helpful with a lot of different pictures and actually tearaways as well. That's been helpful.
Great, thank you. Dr. Liu or Dan Tam, would you like to add anything about the educational resources that you guys use to educate patients?
Yes, we use a lot of high quality educational information from Gilead. They did a great job for the translation, and the quality of the education materials is great. We use a lot. It's free. Anytime we need, they will just do free delivery.
I also agree with that. Gilead also supplies our liver models, and then CDC also has a lot of multilingual products as well.
Great. The next question for all three of you, what kind of technical support or assistance did Hep B United provide, if any?
The first thing, most important, is the mini grant.
Yes, so definitely aside from funding, since Hep B United has been around for longer than we have been, they have been able to connect us with other people as well. Like if we needed Somali resources or different language resources that we weren't able to find online, they would connect us with other coalition members who have been around longer.
I think the Hep B United really provide good networking opportunities, shared resources nationwide. Like summit, the webinar, the monthly conference calls, all these activities, all these opportunities are great for networking, share resources, and improve the skills and education for those the coalition members and the partners.
And I definitely agree with Dr. Liu. It's outside of just the funding, it's a lot of the fringe benefits. such as the technical assistance that you get, and even just the ideas. We decided to go with linkage to care because we've had a lot of support in the past of doing the screening and education, and we really wanted to take this to the next level. So with that, we decided to be able to use the funding and actually get ideas from other health centers and other members in the coalition as well to bring this idea together.
I also want to emphasize that the Hep B United bring all the resources, not only resources, but also advocate for on behalf of the partners. I remember at the last summit, they help us advocate for Gilead to provide medication for our patients. We had a little challenges in the past year after the Obamacare implementation, but I think the Hep B United helped advocate for on our behalf. So we are getting more responses regarding requests for hepatitis B medication.
Great. Thank you all. This question is directed to Kathy. How did you approach nail salons initially and get them on board with what you were trying to do in terms of educating the community?
So again, I've talked about really hiring from the community. So we wanted to find someone, first of all, who understood the culture and the language of nail salon workers. So we looked for someone with experience, and then we actually had a training with OSHA and used that as a bridging opportunity to talk about health. Because sometimes when you first come in and you talk about healthcare to a nail salon worker, they don't really see the connection. But when you talk about, oh, you know, do you know the chemicals that you're using? Do you feel like it's safe? Are your hands tired when you're bent, or, you know, when you're working with your hands all day, or when you're bent over? And we use little mini exercises and training, such as how do you stretch, or what are simple exercises you can do when you're working so that you don't get tired. Things like, oh, you should suggestions such as taking a quick break to just walk back and forth, opening up the windows, and so things that were more relevant to them, to start with that, and even providing some materials such as phrases that English phrases that they can use to speak to customers. So it was almost like a all-encompassing training that we have for them, and we would call these nail salons, we would talk to their owners, and then and ask permission to talk to their staff, and come on a day that wasn't very busy. So as we built that relationship, it was easier to say, oh, you know, did you know the chemicals you're working with could cause cancer? You know, did you know that just where that you should be aware of breast cancer, cervical cancer, colorectal cancer, and hepatitis, especially if you're working where there could be, where you could cut someone's nails and then there's blood, and you could be infected. So starting off from just a general safe environment point of view, and then turning it into health, but really just spending that time to build a relationship. And having someone who understood the culture and came from that background was very helpful.
Great. Thanks, Kathy. This question is for Dr. Liu. Was it difficult to start using WeChat, and would you think that it would be beneficial to other coalitions to use that social media tool to reach the high-risk population?
Create the WeChat account is challenging. We have to, first the account has to be linked with a credit card from a Chinese bank. So we ask one of my staff who has a bank account in China in order to create this account. So that's the most challenging thing. After you create the account, then it's much easier that we just ask our clients to use their cell phone to scan this account. And then everything, all the information, we will go to their cell phone. And it's free, it's very quick. So we don't spend money to print flyers or to print information in paper. Everything we just copy paste through, you know, we can copy paste information from our email, from our email account and then directly into the WeChat account, and then just click send, and you go, and then people can forward. It's like a virus. It's very effective now in the Chinese community. But if people, this is a Chinese marketing tool, but I do not know whether other languages have this type of social media tool. I'm not sure. But it's very popular in the Chinese community.
Yes, thank you so much. So just to reiterate, we had a couple of questions about the eligibility of members to apply to the mini grants and what that entails. In order to apply, you have to be an HBU coalition partner or listed as a website under local campaigns. You're eligible to apply if you are a local partner of that coalition, and you do need a letter of support from the coalition lead. So this would limit it to U.S.-based and coalition partners and members. So unfortunately, we don't have the ability to do an international mini grant at this time. In order to become a member, you can contact the Hep B United website. It's just hepbunited.org. If you're interested in becoming a coalition member and wanting to learn more about it, you can also email me as well. So this is the proposal ideas in terms of the grants themselves. They are part of the cooperative agreement with the CDC, and many grants, unfortunately, cannot be used for policy or advocacy related activities. So with that, I think that covers all of the questions that we had. If you have additional questions, feel free to email us. And thank you all so much for your attendance. And thank you to our speakers and panelists for this rich discussion and giving us a great insight into the mini grant process and what you can truly accomplish with mini grants. So with that, I will end the webinar. Thank you again to our panelists, and I hope you have a great rest of the day.
Thank you.
Thank you.